A number of things. I mean, I think the biggest thing is, right, it takes a lot to put yourself out there online as a physician, as a healthcare professional, and knowing that your identity, your likeness can be used to promote inaccurate misinformation is really, scary to say the least. And so I think this is a big barrier for why a lot of physicians are hesitant to engage online. And for patients, of course, right, it's misinformation. It's promoting information that isn't accurate, that could be harmful. We know that misinformation worsens outcomes, but it also has the potential to reduce trust in that physician. When this happened to me, it was the people impersonating me were promoting everything that I stand against. So here I am saying evidence-based medicine, follow the science, as we think about how to identify misinformation, we say, well, look, is this person an expert? What are their credentials? And if you Google me, I have got good credentials, and I'm a practicing oncologist. So all those ways that we now can use to kind of weed out misinformation are becoming outdated with these AI impersonations. So there's a lot of potential loss of credibility, loss of trust, identity stealing, and obviously worse health outcomes for patients. I think that, we can still use what we have, but recognizing that now it may not be enough. And so what I would add to that is really to just put that out there for patients and to let patients know, hey, there's a lot more impersonation online. There's deepfakes, AI is really playing a role. And so for patients to be aware of that, be mindful of that. If something isn't what it seems, right, it may not be. But I think, and this takes time, and I understand we're all short on time, we're all limited resources, but I feel strongly that as physicians, we can help our patients vet that information a little bit, right? And so what I say to patients is, I hope you feel comfortable enough with your medical team to say, hey, I saw this online. What do you think about that? And I recognize this is a big lift because everyone is short on time. This does take a lot of time, but I think it can foster that patient-doctor relationship if we're willing to hear what people are finding online. Because at the end of the day, right, people are going online to get information. They are looking for more. They want to educate themselves. And so if we see this as a partnership rather than a they versus us kind of relationship, hopefully we can all work together. But I think having a medical team that can help you vet that information is really important. I think recognizing that what we see online, that does not constitute a doctor-patient relationship. And so what I say to patients is if you see something online and you've seen something posted and you're not sure what this is, I hope that you have a medical team in person, a doctor that you're your primary care doctor, your oncologist, right? Whoever it is that you can call and send a message on the portal and ask for that, right? Or make a visit to talk about it. If you're seeing things online and you're not sure and you feel like, I'm a little bit lost, come in and have that conversation. So I think recognizing that what is online is not a doctor-patient relationship. It's also not, what I say to patients is there is a lot of things out there. There is no verification of healthcare credentials. Algorithms promote things that have a lot of likes and follows. Recognize that. And remember, there's nuance to everything. Headlines are sensationalized. Media headlines won't say that it's in mice. They'll just put the headline out there, right? So there's a lot of nuance. And so it's hard to figure out that nuance. It doesn't make it on social media. And so again, just having someone in person that can help you weed that out. The other thing is, especially patients are going through a new diagnosis, treatment, it's just one more thing they need to do, right? So maybe you have a person on your team or patient, like I say this to patients, maybe you have someone, a friend or a family member who can be that, right? Who can collect that information and then help you figure that part out as well. A lot of these fakes and impersonators and misinformation, they're trying to sell you something. So if they are charging you a lot of money, right? Don't send your health information to anyone. Don't pay anything or anyone, right? So I think that's another part of it. Like before you spend any money, wait a second, take a step back before you provide any private information. I think it's a really valid concern. I mean, I will say when I was impersonated, it definitely it puts up a lot of it's very scary. I definitely thought about that. Like, what am I doing, right? Like, what if someone impersonates me and then someone, what are the legal implications of that? What are the ethical implications of that? And I don't have an answer. I think these are really valid concerns. And until there is a bigger stance and a bigger action from the social media platforms and companies to take action against these, we don't have a solution. And so I think though that if people are engaging online, being mindful that this can happen. And if it does happen, sometimes working with, maybe your institutional, some people, if you need legal representation or working with your institution to help with that. But I think I don't recommend pulling back from digital engagement because I think there's a lot of value to it. But just being mindful that this could happen and having a plan in place if it does. I don't think we know yet, honestly. I mean, I think that this is really fairly new and evolving, and people are trying to figure out what this means, right? And I think the concern for everybody is, ethical and legal implications of people using your name and your likeness to promote something that has no scientific merit. The one thing I would say is I don't think you can, until there's bigger action taken on a grander scale, I don't think we can prevent being impersonated by AI. But what I would recommend is if it happens to you, screenshot everything, save any conversations, documents. I think that can be really, helpful to protect yourself, just to have that documentation. But I don't know. I would love to know why, but I don't think anybody does right now. I think it's huge. I mean, I think it goes beyond AI impersonation. I think it's misinformation as a whole. And, the problem with all of this is, and we talked about this, that the algorithm rewards accounts that have likes and follows and engagement, whether or not they're accurate or not. And so if I have said to somebody, I'd like you to get chemotherapy for your breast cancer, and I just saw this happen yesterday online. There is someone who is saying chemotherapy, doctors just want to give you chemo. They don't care. They just want to push chemo. So patient goes to this website and sees thousands of likes and goes, wait a second, but should I really be getting chemo? And now there's been a little bit of that wedge in there, in that really, right? And so, I think getting on top of acknowledging it, and I say to everybody from when I meet them that there are things online that are helpful and there are things online that are wrong and are full of misinformation. And so if you see something you're not sure, I hope you feel comfortable to call me about it, and I'm happy to have that conversation with you. And so as this continues to get bigger, because I don't think it's going away, I think more of this will happen. And I think it really just means having that conversation up front of acknowledging that there are things online that are not accurate and that there are things that are accurate. I think that saying, I think we should not tell people don't Google, don't go online, because they're going to do that, right? So I think instead of acknowledging, I know you might be looking online, here are some of the things that are out there, here are some good resources. So I think part of that is, right, helping our patients figure out what is good online, where they can go, can be really helpful. And just having that conversation, acknowledging it, I think, and then being able and being willing to answer those questions as they come up. Exactly. And I think one of the things that I try to do, and again, we're all limited by time, so by no means am I saying this is easy to do, but a lot of misinformation is based on something, right? It doesn't just come, most of it is based on something. And so if people are asking about a particular myth that's out there or a particular drug that's out there that doesn't have the data, right? Just taking a few minutes and saying, well, here's where this comes from, right? So, and here's this one study, it showed this, but here are all these other studies that show this. So I think really partnering with our patients, and really think, would you like to see the data? Would you like to see the research? I think that can be helpful because I think all of us want more education. And I've been on the patient side and have seen some of that health information, and as someone who has health literacy, have fallen down rabbit holes myself. So I get it, because when you just want information, and it's middle of the night and it's late at night, that's where you're going to go. And so I think being willing to have that conversation, and to recognize that by being open and honest about it, I think we can bridge that doctor-patient relationship forward. But it's really hard, and we don't always, doesn't always work. And hopefully, there's just a lot out there. And so that's why I think doctors should be there. So at least we can provide some evidence-based information.